Hi, this is Junaid, neurocritical care stroke and epilepsy specialist, founder of NeuroCareAI. Today we're going to discuss our most latest product, which is FDA cleared 501k. We're going to go ahead and make sure that you understand what is the real potential of NeuroICH in acute ischemic stroke. The whole point is to revolutionize the way we treat acute ischemic stroke. As you guys know, that stroke is a significant burden. As a matter of fact, if you look at it from a neurological perspective, there's a massive 3.4 billion people are impacted, and stroke is one of the most important one. 160 million people globally are impacted because of stroke itself. And there's unfortunately a rising global burden of stroke, and it's not just the high income countries. It's unfortunate that we see this global burden of stroke more so in low and middle income countries as well. And as you can see, it is the most common reason of disability. It is the second most common reason for death, fourth most common reason for death. And as I told you, the incidence of stroke is rising globally. So what do we do about this? So again, it is one of the key things that we need to understand as far as stroke is concerned. In stroke, time is brain. The urgency of stroke treatment cannot be overstated, because the real question is that in this situation, what you're looking at is for every 1 second, you're losing 3,200 neurons. For every minute, 1.9 million neurons. And not to mention, it's not just about the cells itself, it is about the connections. That's where the memory, the visual aspect, the cognitive abilities lie. And then unfortunately, when you go ahead, it's 120 million neurons and 830 billion synapses. So every second counts when you're looking at stroke care itself. Before we understand moving forward, there are really two types of stroke: the blocking type and the bleeding type. The bleeding type of stroke is unfortunate, in which a vessel could burst as if it's an aneurysmal bleed, or it could have a very micro hemorrhage that can turn into a larger hemorrhage because of high blood pressure. This example that I'm showing right now is essentially over here there is a bleed, and this is a hemorrhage that is noted. However, in the blocking type of stroke, interestingly, initially the CAT scan looks completely normal, and therefore you do not see any abnormality. And unfortunately, at some point in time, as you can see, that you can have a proper stroke, as we have shown over here. As you can see on this image over here, there is a proper stroke that you can see. So the whole point of acute, which is within the first 24 hours of care, is concerned. You see a bleeding type of a stroke or a blocking type of a stroke. Just to give you an example what a bleeding blocking type of stroke looks like. For example, this is the brain vessel that is coming, and you can see over here, right here, there's a blocking. Again, this is not something that the alteplase can do. We're going to talk about, this is not understanding mechanical thrombectomy right now. And as you can see, this one should be in this whole area of the brain over here is not being perfused. And the idea is to either identify it quickly and give a medication called thrombolytics. That's actually called alteplase. Now, alteplase, the reason I'm using the word alteplase is because now it is officially off patent. When you have something that is off patent and is available in generic, it is much cheaper and is available everywhere. And just to remind you, what is this medication? Essentially, it is a clot buster. As a matter of fact, other name that people have used to describe this medication has been cat flow. And the cat flow is essentially, it's a little bit of bitty bit of dose for 2 milligrams. When we put central catheters and then that got stuck because of blood clots in it, you push some cat flow in it, and then it removes that blockage and it goes from there. And that's the whole idea behind it, that you systemically give IV alteplase to give a body a boost of essentially being a powerful blood thinner and work as a clot buster. In some cases, it works great. As a matter of fact, there are clinical studies. I'm not going to get into that. If you guys want me to, I will go ahead and go into that study as well. But at this point in time, you need to understand that alteplase is essentially an essential medicine. It is off patent. It is available cheaply everywhere. And the whole point of this is to first understand that it is not a bleed. And if it's not a bleed, then it's likely a blocking. And if it's likely a blocking type of an agent, you can give alteplase. And these are some of the recommendations that you have to follow from your institute, but within 4.5 hour window, to actually be able to treat acute ischemic strokes. And early treatment is so important. I mean, annual impact is 4.64 million lives. That's insane, the amount of people that you can save with early treatment. The idea behind it is that if you have 2.34 million people, you are looking at around 2.32 million lives impact, 5-year impact. It's huge. These are so many lives saved. That's insane from one disease. Early treatment reduces disability. And I'm quite frankly, this is more important because living with disability is much harder for both the patient itself and the family. And then lastly, there is significant amazing cost savings. As a matter of fact, I don't understand some of these government programs need to put this into production, because at the end of the day, if you are able to just use this to reduce the mortality, which is number of quality years a person has, that is contributing factor of the society, and more importantly, disability, which that same person who was initially a productive member of the society, now disabled, requires some other person to help them, is so important that we have a major 5-year impact cost savings, and that it is about $7.5 billion 5-year impact globally is concerned. So this is, again, as I said, the importance of early acute stroke treatment cannot be overstated. It just cannot be overstated as far as this is concerned. The other thing people have to understand is that, at least here in the United States, the way we approach stroke is that we call it systems of care. Systems of care is a situation in which you do have to understand that even if you're given the thrombolytics, even if you have done the acute treatment, that patient is going to move from a primary stroke center to a comprehensive stroke center, NeuroICU, for further care. As a matter of fact, they have established ideal foundation requirements. If you look at this from American Heart Association and American Stroke Association, what you're going to see is that they have already asked that use of advanced neuroimaging with AI should be part and parcel, because the idea is that the people who are over there are essentially not super specialized. I mean, it took me a while to learn stroke. What I'm saying is that the idea is that you can empower emergency physicians, you can empower urgent care clinics to even, and more importantly, as we are moving towards this, we are empowering mobile stroke units. These are essentially ambulances that are having CT scans built into them. So you can actually give TNK on the way to the hospital and then decide what to do next. So acute treatment is so important. Why would you put a CAT scanner in an ambulance machine? Like, that just doesn't sound right. But when you know this, again, when you know this, that every second, every minute, and every hour counts, you want boom, boom, boom. You save so many lives and limbs by doing this exact same thing. So what our importance of these kind of systems of approach is so important. And we have know that AI is officially shown in multiple studies. By the way, if you want to look at exact NeuroICH systems and sensitivities and specificities that are actually published in the 501 case summary. Enhancing stroke care is the key part, and you get critical notifications. So if you have something, you're going to have show that it is a bleed or not. And of course, you have access to all of the neuroimaging, prior and current, depending on how the integration is set up. And what we want to do is basically empower physicians, the end physician, the neurologist, the ER physicians, not to wait, because every second counts and they can see the image. And I'm going to show you a working example in a minute, and therefore you can save lives and limbs. We're going to bring some more features as we talk to different people. The most important thing to also understand that, remember that I talked about that hub and spoke model. This is the ideal foundation on how to present it. And that is, again, understanding the systems of care approach. This is exactly built in within the NeuroICH system, because we understand, being the former director of stroke neurocritical care, that is so important that we have what we call rollback access management. That's a technical term, but most importantly, systems which are considered hubs, and the hubs are important, and then sites would be actually spokes. And we have a more complete end way in which we have the enterprise grade solution in which admin portals can define what the spokes are, hubs are, and all of the people, physicians, who is going to be the receiving physician at the NeuroICU end, or it is the neurocritical care team, or anyone, depending on where that system needs to go, because sometimes one NeuroICU is full, which is going to be the primary site of transfer, but the secondary backup site is also available. So we give access, unlimited access to the people that you want us to give access, the way the licensing structure is set up. So again, this is extremely important to understand, that we have unlimited users. We do latency monitoring because, as I said, it is very important to us that this is done appropriately and fast. And as I said, we can set up roles, systems, etc., so that you can do that. Again, one more thing that you have to understand about NeuroCareAI, it is a social impact startup. We are very proud of the fact that we are doing so. We make everything. We are extremely proud of the fact that this is available for us in form of neuro. Um, we have a social impact startup, so we make it available for free, just to make sure that you understand, approximately 100% off in specific circumstances. And the reason I'm going to tell you very simple. There are people who come up to ask us that they want this service. I said, glad, but they don't even have a DICOM engineer. And I do not currently have the resources to actually provide, a complete, hand holding for even integrations, etc., which we will. So we are applying for a few grants. And if you have something in mind, let us know. We are always looking for grants to make this available worldwide. But again, for low and middle income countries, we are very happy to say that we are a social impact startup. I just want to give you a brief overview of a lot of different products that we have. Again, you talked about the FDA. We have truly a mobile viewer, and this is not just a web wrapper. This is a true built up, ground up as a native application. The speed is amazing in this situation. And of course, what we can do is we can integrate any AI into this mobile application. You can get mobile notifications on this. We are actually, some of these AIs are not FDA approved, and these are, again, we are opening it up for the world. So anyone who wants to push their AI through our applications, we are happy to. And the most crucial feature is about automated radiology report generation. I'm going to make a video like this to introduce that feature to you. Integration is super simple and fast. We have ISAMD, which is our clinical documentation, which connects to any EHR. And of course, we are obsessed about cybersecurity. We cannot take cybersecurity more seriously. We do all these controls. And as I said, it's annoying at the end of the day, but it's very, very important in today's environment. Again, I'm very grateful. If you have any more questions, please let us know. And reach out to us if you have any. And if those who want to get into more details about this product or other products, make sure you book a demo with us. Thank you.